Now, we're about to enter into a huge family of gram-negative organisms called the Enterobacteriaceae. The features that this family have in common are the fact that they're all gram-negative rods. They are all facultative anaerobes, okay? So what did we say that meant before? We said that means that they use oxygen when it's there, and when the oxygen is gone, they'll go ahead and ferment. All members of this family at least ferment glucose, okay? So you can never differentiate Salmonella from E. coli from Shigella based on glucose fermentation. They are all oxidase negative. Now we've talked about some agents that are oxidase positive. We've talked about Pseudomonas. We have talked about Campylobacter, okay, that's oxidase positive, and we've hit Vibrio, that's oxidase positive. So those are some agents of gastroenteritis that are oxidase positive. The Enterobacteriaceae, though, are all oxidase negative. So if you see a positive oxidase test in the vignette somewhere, you're going to know that it's not a member of the Enterobacteriaceae. All right? This family as a whole can also reduce nitrates to nitrites, and, very important point, they are all catalase positive. What does that mean? That means that in the case of chronic granulomatous disease, the members of this family are going to be some of the bacteria that are causing recurrent infections with CGD. Now, as far as the virulence for the family is concerned, of course, they all going to have endotoxin, which, remember, is LPS. Some of the members also produce exotoxins. In the case of E. tech, for example, in the case of E. hec, Shigella are examples where you produce exotoxins that are secreted as well as those endotoxins. Now, the different antigens that you see as far as the Enterobacteriaceae, you have the O antigen, the H antigen, and the K antigen. So we'll look at those specifically first, okay? What those are used for are serotyping of the organism. So the organisms are serotype based on the cell envelope, or the O antigen, the flagellar antigen, or the H antigen, or the K antigen, which is the capsular antigen. The best example I can give you of that is in the case of enterohemorrhagic E. coli. EHEC, as you know, we've had several epidemics of enterohemorrhagic E. coli in the U.S. over the past several years, related to all types of different things, from spinach to petting zoos to undercooked hamburger. And the serotype most often associated with disease is the O157H7 strain. That is the serotype of EHEC, most often associated with clinical disease in the U.S. All right? Now, the example I can give you for the K serotype is in the case of E. coli that causes neonatal meningitis. E. coli strains that cause neonatal meningitis are typically what we call the K1 strain. So they all tend to have that capsule. All right? Remember, capsules are very important in bacterial meningitis. Now, Salmonella, okay, Salmonella in particular for Salmonella typhi, the capsule is called the VI capsule, which stands for virulence. So that's what really helps aid in the virulence of that particular organism. Diagnosis, we've mentioned a little bit before. I believe I mentioned when I was talking about Listeria that E. coli is also beta hemolytic. So on blood agar, it would appear beta hemolytic. It grows on MacConkey, and what's important to know, remember, MacConkey is differential and selective. What does that mean? That means we're selecting for the enteric organisms, and we're differentiating between lactose fermenters, which are going to be pink on MacConkey, and the non-lactose fermenters, which are going to be colorless on MacConkey. The other type of agar that you can use is the EMB agar. Remember, that's the agar in which E. coli gets that metallic green sheen. So it's very easy to pick up, for example, fecal contamination in water supplies when you're using the EMB agar. Now, what this schematic does is helps you break down the lactose fermenters from the non-lactose fermenters. By far, the most important lactose fermenter is E. coli, but you can't forget that Klebsiella pneumoniae also ferments lactose. Okay? So you get an organism that's pink on McConkey, you're going to know it's either E. coli or Klebsiella. Now, where it gets a little more complicated is with the non-lactose fermenters, because we have Proteus, we have Salmonella, Shigella, and Yersinia. Now, these organisms are differentiated based on two things, whether or not they're motile and whether or not they produce H2S. The way to do this is, if you can remember the ones that are motile H2S producers, just remember the others are the non-motile, non-H2S producers. So remember, salmon, Salmonella, salmon swim upstream, so we know they're motile. Proteus is one of the most highly motile organisms that we know. In fact, you'll rarely get an isolated colony of it on a plate. It swarms across the entire petri dish. Okay? In addition, on certain types of media, like hecto and enteric media, like the triple sugar iron slants, you can detect H2S production, which will appear as a black precipitate on those particular types of agars. Okay? So Proteus and Salmonella are motile H2S, and Shigella and Yersinia are non-motile, non-H2S producers. Now, the biggest way that that's going to come into play on the exam is in differentiating Salmonella from Shigella. So if you are given a case of gastroenteritis and they tell you that you have an H2S producer, it'll be a non-lactose fermenter but an H2S producer, you're going to know it's Salmonella. Okay? If they tell you have gastroenteritis and you have a lactose non-fermenter non-H2S producer, you know that that's probably going to be Shigella. So that's when that's pretty much utilized in the differentiation of Salmonella and Shigella.